Welcome to another episode of The Worthy Physician, and today I have Dr. Amna Shabbir. I'm really a fan of the positive messages that you leave, and I'm really happy that you're here to share your experience.
Thank you so much, Sapna. I am a podcast fan and I'm excited to be here. I've been listening to the Worthy Physicians podcast since 2022 and many of the episodes, and I am really grateful for the work that you've been putting out.
Thank you. It actually started out as a way to try to figure out why is there so much burnout, moral injury, physician suicide. I lost my best friend to suicide in 2019, but the question is, why isn't this being talked about? And so hoping to normalize that conversation. Thank you.
Absolutely.
Tell us about yourself. What field of medicine are you in? And what gets you up in the morning?
Yeah, so I am a geriatrician internist. I love taking care of older adults. I'm also a coach for early career physicians. And what gets me up in the morning these days is really on the days that I go to the nursing homes, I love seeing my patients that are in the SNFs and the rehab facilities. There's something very spiritual almost about caring for older adults for me. So I love that experience. And the rest of the days and the rest of the time, I'm all consumed about all things physician wellness these days. I really want to do as much as I can. So I'm writing, I'm sharing, I'm coaching, I'm here. Those are all the things.
And what got you into that part of maybe to frame it as preserving the art of medicine?
Yeah. Yeah. I think that's a really good way to look at it. I think this stemmed from just a longstanding desire to help as many individuals that I could, not just as a physician, but also as a colleague. And then there was my own experience of burnout and moral injury and postpartum depression and everything all lumped up into one, whatever diagnosis we want to give it, that has brought me to where I am. When I started my job right out of residency, I worked as a primary care physician for almost 4 years. And after that, I went back to medical training and trained as a geriatrician and currently working in post acute long term care part time. So, right out of residency, I was as passionate as can be humanly possible to practice primary care. I always be a primary care physician at heart. I don't think that my entire soul and being can divorce that existence ever. So I was extremely passionate and I was ready to take over the world. We were going to do this chronic care management. And then I started, and slowly over the course of the first 6 months, I started feeling the effects of burnout. And I didn't know what to call it at that because that's not what I was looking for. I was looking for how can I make my life great? Of course, I had a 1-year-old at that time. And then also, how can I practice the best medicine possible? So really was I was trying to show up the best way that I could. And having worked as a really celebrated resident, had good experiences from residency, I was looking forward to this chapter of my life to be maybe the best chapter. I have arrived and I'm here. But unfortunately, it was the other way. And there was that dream that I had of being that primary care physician who did everything. And I was doing that. And that was part of the problem. But I started to feel very overwhelmed, overall exhausted. There was never enough time to rest, to sleep, to actually exercise, to eat good food, to have any time with my daughter. And I was wondering, okay, I worked so hard to get here. Is this it? Is this what I have worked all my life to get to? So,
Yeah, no, I'm here nodding my head because I primary care is difficult. I don't think that admin or other specialties. I think everybody's going to say this about their specialty, and rightfully so. What was it? There was an article that came out a few months ago. It takes 27 hours to do what a primary care physician does, 27, 26, something like that. So essentially, day, but we know that clinically we're roughly in there for about 8 hours. And most of that seeing patients, that's not even including the administrative part. And the arrival fallacy is exactly that. And I'm looking at the sign that you have behind you. Life isn't about finding yourself, it's about creating yourself. And so I think that it's very common. And so how did that change your perspective, or how did you pivot? What happened next?
Yeah. And so I will say this, that when burnout happened and all the bad things were happening, I was reflecting on what do I want to call it? Do I want to call it burnout and moral injury? And yes, absolutely. Like those are, if I was to use the clinical terms, they fit the Maslow burnout inventory and all the three common core definitions. And I absolutely feel Dr. Wendy Dean's work surrounding moral injury. So yes, all of that was happening. But what did I as a human experience? And that's what's up now. I was thinking yesterday, you know what? I had heartbreak. That's what I would call it. When you work so hard to get to your dream life and you think this is what it's going to be, it was heartbreak. And then there was this loss of dream, like this sensation that I really cannot do what I want to for my patients, and I really cannot take care of myself the way I want to. And so there was that loss of dream, and then I grieved that loss. So there was heartbreak and then there was grief. And then slowly, as all of this kind of melted into each other, I think there was existential distress. Like, this is what's happening, period. And then we can call it clinically, surgically, we can call it whatever. So as I acknowledge all of this, the human in me was really heartbroken. That's what was happening. And how did I pivot? And what was I going to be doing? So initially, when all of this was happening, my solution to every problem all my life has been to work hard. So I said, I am going to work hard and work myself out of burnout. That's what's going to happen. I'm going to see how much I can advocate for myself, how much differences I can create in my workflow. And yes, I did try to do some changes that were helpful, but taking on more tasks, and that's really never the answer. So I thought that, you know what, I'm lacking personal fulfillment. Maybe I need to do more teaching. So I took on more teaching roles, and maybe I need to do more QI. So I mean, that maybe that will help me. So I was doing peer teaching and QI and teaching students, but that wasn't the answer. About 3 years in, I had a moment where I just sat down. And this was after I had already received some pharmacotherapy for postpartum depression that happened after I had my second child. During this process, I also had counseling and I had coaching, which is coaching is still ongoing. In that moment, when I was able to have some relief after asking for help, I sat down and I realized, what is the one thing that gives me the most joy out of what I do in primary care? And that was really taking care of older adults. Like, I love older adults and everything about them. And the older they are, I just love that. And I love helping families, and that's what really gives me joy. So I realized that part. And the second, how I really thought that I needed more training, and which is true. Like, we don't get enough exposure to geriatrics just in our residency. So that's where I made that decision to actually go back to medical training to treat my burnout. That's also not something we frequently hear, like more training to treat burnout. Okay. But I thought that really aligned with my purpose and fulfillment goals and actually helped me in that regard. And the second thing really was the process of asking for help, which was so difficult. I am a South Asian female. I'm also an international medical graduate, went to medical school in Pakistan. And all of those things really shaped my identity culturally as well. There was an element of not asking for help. And really, like, the more you work, it's almost like morally better. And I think that transcends culture. I feel that my culture was there, but also the medical culture perpetuates the same beliefs. All of that really was a hindrance in terms of asking for help. But once I realized I had to move past that, because I was given choice. We all have choice. No matter how small we think it is, it's non-existent, but we all have choice. And I know that a lot of times I'll have my friends, they'll argue with me. This is just, I'm in a toxic workplace. I can't do anything about it. But I will always say that the moment I recognize that I have a choice to either stay, a choice to leave, a choice to advocate for myself, even if I was able to make small changes around my environment, I had all those choices. And I chose at this time to further pursue medical education, to really hone in to what gave me sense of joy and sense of purpose.
Even though more training and wouldn't necessarily be the answer. The key here is that you changed to do something that aligned with your values and purpose. It really realigned what you were doing with who you are. But you do have a choice, and you chose to try something that is not necessarily that's a little unconventional.
Yeah. Yes.
And so when did you realize that you had that power of choice?
The moment I had some white space is when I started to recognize that, because when you're just surviving, barely surviving, you wake up and you're waking up in reactionary mode. Oh my goodness. Like I already know my in basket is exploding. Kids are having tantrums. I have to drop them off to preschool, school. I have to go. And that would only happen if my husband was out of town. Otherwise, patients are scheduled so early in the morning. You can't, maybe you're dropping one kid. It's a mess. It's all over. So there was a lot of reactionary moments. It was cruise control, whatever I could do. But then I actively started recognizing I need time off. Where can I create that time for myself where I actively block out time for reflection? And that was also after I was able to get help. So in the moments when you are completely busy and absolutely overworked, I felt like there was no moment to actually have a breather and think. So when I created those time windows, even if they were just 30 minutes, 1 hour, I was able to sit down and ask myself, what are you doing? And do you want to keep doing this? And then it was like, how are you living? Do you want to keep living like this? And the answers they started coming to me. And during this time, I think that another moment that provided me a lot of opportunity for self reflection was just as I started to get better from my postpartum depression, the pandemic started. And then a couple of months into the pandemic, I actually fell and fractured my right foot. And that was an entirely long process of healing, which I was in a cast. I couldn't drive for about 6 months. It was like the perfect time to do telemedicine, let's just say that. So I continued to see my patients from home, but it was also very disability inducing in a way because I had a 1 year old who was running around and I couldn't care for her. I couldn't drive. So all the time I was really in lockdown at that time. So the cast was on for about 2.5, 3 months. And that was the time I practiced completely in telemedicine from home. And those were the moments that allowed me some perspective. Really, where do I want to go from here? Because I didn't have my commute. Otherwise, I was still seeing 4+ patients, something somewhere close to that. But I felt like the commute went away and I was able to sit with a piece of paper and just sit and think and really get the help that I needed. And then when I returned, I was in a brace, but putting on PPE with a brace and a scooter, that was a whole different experience because I was helping in the respiratory care center. So it was just one thing after the other you were thinking and yeah.
Wow. Some of those things that you're talking about really so for internal medicine patients, 24 is a lot. That's a lot. And then to add that onto the pandemic and PPE with that injury, that brings a whole that kinda knocks it up to a whole whole 'nother level. And where are you now? How have you transitioned to where you are now?
I think Sapna, the transition happened more so it was like this mental journey because pretty much everything that's going to manifest in your life starts with a thought and it starts in your brain. It starts as a dream, as an idea. And the moment I made that choice that I was not going to live like a sick human being, which it was, like I was ill at work and at home. I was juggling too many balls. Some of them were falling all over the place. Usually, they were the wrong ones because I at work I was 100% like you couldn't tell what was happening internally. So everything was it was all up. It was all messed up. So the moment I made the choice that I couldn't proceed with life like this, I think that was really the tipping point for me. And from that decision of choice, everything else manifested from there on. And I realized that often there's a lot that goes on internally that prevents us from asking for help. And of course, social conditioning, everything that we have is there for a reason. Like even the moment that it took me forever to ask for pharmacotherapy for my postpartum depression was the fact that I didn't want to write on my license. I didn't want to report it. And I felt like a failure. And so that the moment I decided that I am not going to continue to feel this awful forever, I feel that was the tipping point. And so I feel very fulfilled in the way that I can say professionally, I am continuing to serve my patients. I am working clinically part time right now. For me, that was the choice that I had to make between leaving medicine completely, which again, it contributes to that feeling of loss and feeling of failure and feeling of heartbreak when you work so hard to get to where you want to be and then to have to leave it completely. But there were moments where I looked at my husband and I said, I want to walk away completely from everything. And that includes medicine. So now I feel really good that I'm practicing part time. I am getting to spend time with my patients. And I'm realizing it's not that I'm practicing part time. Like it's like a slur when you use the word part time. And sometimes it just lands very differently with people. I feel very proud of the care that I deliver because when I'm with my patients, I'm with them. I'm with them 110%. And when I'm not, I'm really focusing the rest of my energy with my coaching practice. And my current focus with that is to help other early career physicians that are just starting out and that are suffering in so many different ways. And sometimes when I share in my posts that are specific to early career physicians, I'll have some other colleagues that are more seasoned say, I still feel like that. It's not just you guys, it's like all of us. And that makes me sad, but also gives me this sense of a shared human experience that we're all part of when we're in the practice of medicine. But that also proves my point that really caring for our early career attendings, yes, there is the care that you give residents and medical trainees, but there's also that care that needs to be given during transition points that is so important and is so overlooked that needs to be there. So right now, my focus is on helping as many early career physicians as I can.
I really love that because you're right. We train so hard in medicine, medical school, residency, thinking it's gonna be one way, but then when we get out, it's a completely different and but it's a different world. It's a different world, and we don't have a lot of control over, for example, like insurance and the how things are structured. But one powerful thing is that you have the power of choice. And it's I think it's something we overlook as physicians because of the training, because there are so many hoops that we have to jump through in medical school and residency, and then to become an attending, we really give for a short time, sometimes a longer period of time, we give that power up. Or we think we gave that power up. We can always take it back. There are consequences, but we can take it back. What is one of the what is one of the biggest struggles you found yourself having as an early attending? For example, mine was learning how to okay, what are your top 3 issues and coding for insurance purposes.
Yeah. So I think that mine was operating under the fallacy that I had no choice. I would, to drive the point home initially, as you said, it's conditioned out of us in a way that we are powerless. And I will say that I still see many friends operating under, they continue to operate under the same fallacy that, yeah, you have no choice. This is what happens. You graduate and then you get a job, and then the people at the job tell you what to do and then you keep doing that and then you hate your life and that's it. That's being in medicine. Or you hate your life most of the time. Of course, what we do when we're providing patient care gives us all joy, and that joy, when it's completely dulled out, that's not good. But I think that was one of my biggest learning points and biggest challenge. On the day to day, I felt that setting boundaries with time was so important. And the fact that boundaries need to exist, boundaries need to be there. And you can say the B word without feeling horrible, and all the other social conditioning that came along with it being a female of color and all the other things. So I think that the moment, and I took them very seriously. For me, I love to stay on time, on our time. And I was going home at 6, 7, 8 p.m. some days because I would not say no when a patient showed up late and I would see them. And then I also felt terrible if I was late because a couple of patients were late. And so the problem starts to happen is when we're exhausted, we're tired, we just keep up with, okay, let's just keep the day going. I don't want to have a conversation surrounding this because the moment you start having a conversation, now you're a problem. But if you just, let's just, I'm going to go ahead and use an extreme word. If you just shut up and show up and just do your work, then you're a good doctor. And I think that most of us forget our choice, forget that we have a say, and it's such a disempowering place to be in. And I felt disempowered consistently. The day I realized that I have choice and the day I just started with time boundaries. And I swear it was really difficult to do that. But when I set the boundary like a boundary and not like a request, then it slowly started to seep in. I also did a lot of education with my patients. I told them that I just have 15 to 20 minutes to see you. And in that time, you're going to be checked in at the front desk. The medical assistant's going to be taking your vitals, and I'm going to go through all your medical issues. That's not a lot of time. And a lot of patients were actually shocked when they heard that this is the time that's allotted, and they actually were very sympathetic. They commiserated with me that the US healthcare system needs some help and this is not perfect. And then they started to make an active effort. So I communicated with them, it wasn't just a unidirectional, you need to do this. I got buy in, and when I left my patient panel, I used to have, and this is unbelievable, almost zero late patients. And I had a very high patient satisfaction score without prescribing any questionable medicines. I was well loved. Let's just say that. And setting boundaries did not make my patients hate me. You just start aligning and matching with the people that match with your energy and your principles using that.
No, I couldn't agree more. When I say those things, I'm talking about boundaries because for me, when I started, they were non-existent. I said yes to everything. And yeah, you don't want to create any waves because you're the new one. And that's, yeah, exactly. And gosh, the way you said it was, gosh, I did sign up for a miserable existence, didn't I? But that's not the truth. And so thank you for sharing those reminders of boundaries and choice and to really trying to create what you want to see because it's not this box that we have to stay in. The box of misery, that's not a box we have to stay in. And so where can people how can people reach out to you, on social media and so on and so forth?
Yeah, absolutely. You can reach out on Instagram. It's dr.amna, AMNA SHABIR. My website is also dramnashabir.com. And I'm pretty active on LinkedIn and Twitter as well. Just type in my name and it'll pop up. I have created a free ebook, which is a resource that has boundary setting, among other tips I wish I knew on the first day and the first couple of months. And I would still argue some for first couple of years when I started as an attending. So if individuals are interested, they're welcome to go ahead and grab that free resource. I'm hoping to share more free resources. And I have just launched my second venture, which only exclusively focuses on early career physicians. It's called Early Career Physician Coaching. And I'm hoping to create a platform that creates it's not just coaching, but other resources that are all consolidated in one spot as you transition into your role as an attending. And not just that, like there is that initial honeymoon period which some people have. Mine was burnout, but some people have a good time while your clinic is ramping up and you're not feeling it that much. But afterwards, like a year or 2 years in, you can start questioning, is this it? And that's normal. We need to normalize that. So I'm going to be sharing some resources on those lines as well. So really, it's okay. You don't have to be 50 before you realize you're burnt out. And I'm using a number, and I probably shouldn't because some people start their medical education journeys later as well. So you could be a young physician in the terms of like medical education, and it's okay because I had some comments handed that were sort of ageist in a way because they're like, "You're so young. What have you done? Why are you already so burnt out?" Let's not compare and despair misery. Like, I have 20 miserable years under my belt. You just only have the first one. No. And this is This kind of dangerous conversation is what leads to dangerous outcomes when people then don't want to ask for help. So, my goal with this platform is to normalize not just asking for help after, as the WHO definition of health and wellness goes, right? It's not just the absence of disease. You have to actively invest in your well being and you have to advocate for yourself. I really want to highlight this point. Physicians are very passive, and I think that needs to stop. And that's where the whole concept of choice comes in. If enough physicians start making active choices, the system can change. And I'm feeling very positive with our younger physicians are trying to think outside the box. And so I'm very hopeful.
I've seen that as well, and I share that same hope. But I thank you for pointing that out because burnout can happen at any time. But I love the fact that you're focusing on new attendings. The thing is that life is nuts and things hit you when you least expect it. So it's silly to sit here and say like you can't be burned out or moral injury because you're new. And I think research has shown that like in the first 5 years, that's one of the it's when it hits within the first 5 years, and that's a high risk population. So all this will be in the show notes. And what is one last pearl of wisdom you have to leave for the listeners?
Ask for help. Don't wait. Don't wait till you are feeling physical manifestation of what I alluded to earlier as existential distress. Things, if they don't align and if they don't match, and if every day you go home and you just don't feel good, that is symptom and sign enough for you to go ahead and ask for help. And help is available, help is out there. Please take that first step.
Thank you very much for that. And just thank you for everything you're doing. And these will be in the show notes.